and I'm a DO PhD student working under the Ohio Musculoskeletal and Neurological Institute. And I primarily focus my research on the interaction between the central nervous system and mobility, and how this relationship may be altered in those following injury. My advisor, Dustin Grooms, asked me to provide a very brief overview of specific contributions of inflammation to some of the central nervous system adaptations we observed following ACL injury. So I imagine Dr. Grooms described, or at least mentioned, some of the changes to the central nervous system we observe in those after ACL injury. I listed some of these right here. So these include, but of course are not limited to, deficits in somatosensory input from the ligament as well as the joint. We also see reductions in quadricep muscle function, or where we get atrophy, weakness, as well as a reduction in individuals' ability to voluntarily contract their quadriceps. We also get changes specifically at the nerve innervating the muscle spindles, where we get a reduction in excitability of the 1A afferent sensory pathway, as well as deficits across the spinal cord and all the way up to the brain, where we get cortical motor, or essentially the track between the motor cortex all the way to the quadriceps. We get a depression and excitability. And then using MRI as well as EEG, we've also observed changes specifically at the brain, specifically in regions involved in cognition as well as visual processing. So when we look at some of these central nervous system adaptations after an ACL injury, and if we hope to address some of these or resolve some of these adaptations, we first need to take a step back and understand why mechanistically these are occurring. However, it becomes somewhat of a challenge as several factors likely contribute to some of these changes we observe. It becomes difficult to parcel them out. Further, many of these factors may cyclically reinforce one another. So for example, disuse and muscle weakness and inactivation, they may cyclically reinforce one another. And therefore, while it's useful to experimentally investigate the role of each of these factors, there's not one single factor that solely drives neuroplasticity after ACL injury. It's also important to note that not just the injury may be contributing to these, but all these other factors related to recovery, which I'm sure Dr. Grooms probably talked about some of these, as well as behaviorally and some of the functional impairments. Once again, all of these are likely contributors. However, for the purpose of this discussion, I'm just going to talk about specifically some of the empirical and theoretical evidence in support of pain and inflammation as a driver towards central nervous system adaptations. So acutely following partial or complete rupture of the ligament, you get this rapid intra-articular swelling, which is a result of hemoarthrosis as well as the infiltration of inflammatory mediators. Fluid aspiration of the joint has revealed increased levels of pro-inflammatory cytokines such as IL-1, IL-6, and IL-8. And then later on, we see these increased levels in IL-10 as well as IL-4. So it's important to note that in the case of traumatic joint injury, any dysregulation in this cytokine expression within the joint capsule and surrounding tissue can alter normal neuronal signaling as well as synaptic function. And while inflammation may be to the injury, may be constrained to the injured joint, dysregulations in cytokine can cause disruptions in signal transduction, synaptic communication, as well as neuronal firing of surrounding peripheral nerves, which can all lead to changes in receptor thresholds, which can lead all the way up to the spinal cord level, all the way up to the brain. So there's been a few investigations that have tried to determine what is the role of just joint distension, which is an aspect of inflammation. And what they've observed is that there's changes in afferent signaling. So individuals who have underwent this joint effusion have this reduction in quadricep voluntary activation. We also see similarly reductions in isometric strength. So that's this bottom left image. We see a reduction in those who have effusion within the joint. We also see changes at the nerve that are innervating the muscle. So you see reductions in excitability of that 1 afferent pathway, or what some people call the spinal reflexive pathway. We also get changes all the way up to the through the cortical spinal system, where we get alterations in cortical motor or cortical spinal excitability. Another aspect of inflammation is pain. Especially, it's difficult to talk about inflammation without mentioning pain, as these two are highly coupled together. So pain and noxious stimuli can alter firing patterns through the activation and the sensitization of group 3 and group 4 afferents. And all of these are present within the joint as well as the ligament. So acute pain has been shown to alter spinal reflexive as well as cortical spinal excitability. We also see reductions in muscle strength, specifically in those experiencing experimental knee pain. You see this reduction in MVC peak torque. Again, you see, similar to the effusion, you see this reduction in quadricep voluntary activation. As I mentioned earlier, you get this similar reduction in excitability of this 1 afferent pathway of the muscle. It's also important to note, somewhat interestingly, some of the work by Jochen Baumeister using EEG and some of Dustin Grooms' early work using MRI has revealed global increases in specific regions found within pain networks, specifically in the frontal and sensory brain regions. And many of these are involved in pain processing. It's important to note, it's still unclear why these regions are activating. It's still a new area of research. So it's still unclear whether these regions are globally increased in response to or as a result of pain experienced by the injury. So I mentioned some of these isolated experiments that tried to determine aspects of inflammation and whether inflammation has some sort of role, whether it's effusion or pain. However, if you look at just some of these changes specifically in ACL patients, so before these weren't necessarily individuals after an ACL injury, but if you look at some of the observations we see in patients after an ACL injury and when they occur, it can actually give you an idea of what the role of inflammation and pain may play. So specifically, researchers such as Adam Lefley, a lot of his work, has suggested that pain and swelling at the acute phases of injury may explain bilateral reductions in this quadricep 1 afferent excitability, or once again, the nerves innervating the quadriceps, this spinal reflexive pathway. And then while in the case of ACL injury, pain subsides and inflammation wanes, surgical reconstruction reinitiates tissue damage, inflammation, as well as pain. And therefore, we actually see a further reduction in this 1 afferent pathway to the quadriceps following ACL reconstruction. Interestingly, we don't see any changes in the cortical spinal or cortical motor excitability. Once again, that's from the motor cortex all the way to the quadriceps. However, we do see reductions in cortical spinal excitability later on in the rehabilitation window. Therefore, as acute symptoms wane and rehabilitation restores function to the knee joint and surrounding musculature, immediate changes to the spinal cord may resolve. So these specific changes up top seem to occur early on following ACL injury and reconstruction. However, we do see this kind of switch into more cortical spinal changes. So just rehash what I just mentioned. Inflammation likely contributes to early changes in the 1 afferent pathway, as well as some of the weakness observed in those following ACL injury. However, inflammation does not appear to drive some of these later changes, in specifically within the cortex, or is likely not playing a role in persistent muscle weakness. So that's just a kind of a brief overview. I hope I answered any questions you guys had. Feel free, if you do have any more questions, to reach out. My email's listed there, and I also have a Twitter. I'd be happy to answer any questions. Thank you.